You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Welcome to the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you for listening and joining me. Today I'm going to share a recipe for dental health based on holistic premises. And I'm also going to give you some tips and hints on how to better support your oral hygiene and therefore your overall systemic health and well-being. Now, I'm a dentist with over 30 years experience with my own practice here in Brisbane. If you want to find out more, you can hop on over to holisticdentistry.au. But for now, let's get in the zone. Thank you for joining me. I'm Dr. Rachel of Evolve Dental, holistic dental practice in Kenmore in Brisbane. And today I wanted to share with you my recipe for dental health. You know, what does it take to have healthy teeth and gums and a healthy life? Well, holistic dental health looks at your overall health as well as the health of your mouth. And they are more connected than you realise. You need to remember that the same blood that travels through your teeth and gums is travelling around the rest of your body. The whole body is interconnected, and that is the essence of holistic healthcare and holistic dentistry. If you want to look after your whole body, then it is essential to care for your mouth properly and visit your dentist regularly. To prevent dental disease, it is vital that you brush and floss and don't eat too much sugar. However, as I've shown you through my many blogs and videos, this is not the full story. And I feel dentists need to focus more on assisting you to have optimal nutrition and balanced lifestyle and not just on brushing and flossing alone. Dental disease is a sign of systemic illness and imbalance, and no amount of good oral hygiene will fix that. Yes, a healthy mouth is crucial for having a healthy body, but the two go hand in hand. You've got to have both. So these are the basics for health. The basics of healthy living, and they're not some mystery, they're the same for nearly all of us. Number one, a healthy diet, stress reduction, stress management, no smoking, no recreational drugs, and I would include alcohol in that. Regular exercise, satisfying employment, unpolluted air, water and environment, strong positive connections to family, community, and to have an expression of spirituality, whatever that be for all of us. And despite improved oral health education and controversial fluoridation programs, tooth decay and gum disease and oral health issues are on the increase. Fluoride is not the answer to tooth decay. When we've got excessive carbohydrate and sugar consumption, along with a stressful lifestyle, creating acidity and leaching of minerals from bones from your teeth, which creates increased risk for tooth decay and gum disease, fluoride is never going to be the answer. The answer is to rebalance the body, create an alkaline environment and increase mineral uptake and absorption so you're able to remineralize and strengthen that tooth enamel and do it naturally and in return reduce the number of bacteria present in the mouth. This can be achieved through diet and lifestyle. So I'm going to share the keys to dental health. Let's start with stress, diet, nutrition, sleep quality, hydration, toothbrushing and flossing because they are the keys to dental health. It has to be a total body package. It has to be aimed at achieving a balancing harmony throughout the whole body. Let's look at how you can reduce your stress. Go for a walk, meditate, take a bath, spend some quiet time with yourself, get out into nature, have a massage or go for a healing session. Diet. No, I'm not talking about calories, but nutrients. I want you to eat real food, avoid processed, cut out sugar, refined carbohydrates. Eat more good fats, things like olive oil, avocado, oily fish, coconut oil. Lots of vegetables and not too much fruit. Only eat what you need and eat when you're hungry and don't overeat. Let's look at quality of sleep, not quantity. You need to go to bed rested, wind down from your day, switch off that mobile device or laptop, your iPad, turn down the lights and let your body know it's nighttime. Too much blue light at night and not enough sunlight during the day, that's going to confuse your brain, doesn't know what time zone it's on, reduces your melatonin production, and that is the hormone that controls sleep. Hydration, this is simple. Just drink water and lots of it. Oral hygiene, yes, I'm going to talk about it. Brush and floss twice a day. Do it thoroughly, but be gentle, be methodical, and take your time. I'd recommend using a tongue scraper and clean your tongue every day. Use an alcohol-free mouthwash. I want you to also love yourself. Be kind to yourself and your body. A large contributing factor to dental decay is our diet. If you can have perfect blood sugar, have balanced ions of calcium and phosphorus in the body, consume your fat-soluble vitamins A, D and K, and minimize your sugar and carbohydrate intake, you will be at a much lower risk for developing cavities. Add to this a natural mouth rinse containing ingredients like vitamin K, tea tree oil, aloe, myrrh, and they naturally decrease inflammation and fight bacteria that cause tooth decay, and you are going to have a perfect recipe for dental health. Make sure you see your dentist regularly. Tooth decay with age, tooth decay is not normal. A nourishing, vitamin-dense, food-based diet, this has been replaced with our Western, chemically laden, factory-made foods. They lack vitamins and nutrition. And without the good sources of fat and water-soluble vitamin, your body is going to decay over time, and so will your teeth, because what you're eating will never support good health. Tooth decay, the risks of tooth decay depend on the mineral content of your diet, particularly the amount of calcium and phosphorus. Having fat-soluble vitamins, vitamins D, A and K2. The availability of minerals for absorption, and that's determined by, are you eating things with phytic acid? And that's things like grains and legumes, and that prevents mineral absorption. Sugar alone does not cause dental decay. Cavities occur as a result of imbalances in calcium and phosphorus and metabolism and too much acidity in the body. When your calcium-phosphorus ratios are out, then you get tooth decay or gum disease because your body is having to draw it from your teeth and bones. Correct those levels of minerals by changing your diet and lifestyle, and that's going to help you resolve the problem and greatly reduce your risk for dental disease. It can even halt the progression of early tooth decay and reduce very small cavities. As a holistic dentist, my aim is to help people like you more aware of their overall health and guide you towards preventing or managing diseases. It's not just about drill and fill. It's not just about floss, brush, and don't eat sugar. There is much more to it than that. I want to share with you my top 7 tips for healthy teeth and gums and what you can do to have healthy teeth and a healthy smile for life. Good oral hygiene is necessary to keep your teeth and gums healthy. It involves brushing and flossing and regular dental visits. However, the health of your teeth and gums is much more than just cavities and gum disease. Research shows that there is an association between the health of your mouth and your overall health. Without treatment, tooth decay or gum disease, gum problems will lead to pain, problems with self-confidence and tooth loss. And these issues may lead to things like malnutrition, speech problems, and other challenges in your work, school, or personal life. You can prevent these problems with proper dental care both at home and in the dentist's office. Just takes a little bit of effort and a bit of know-how. So here are my 7 tips to keep your teeth and gums healthy. Number 1, brush regularly, but not aggressively. If you brush twice a day and you're using dental floss, this can help keep your teeth and gums really healthy. But if you're brushing your teeth twice a day and you're doing it too hard, then you're not only removing the plaque bacteria and trying to keep your teeth clean, you're also going to be scrubbing and wearing away your tooth enamel. So you should be brushing using small, gentle motions and taking care to brush the front, back and the top of every tooth. This process is going to take about 2 to 3 minutes, and you should avoid kind of sawing back and forth motions because they can damage your gums as well as the teeth. You brushing too hard, using a hard brush, that's going to damage your enamel and your gums, and this can include leading to things like sensitivity, permanent damage to the protective enamel on the teeth, and gum recession and erosion. So I'm going to recommend that you use a toothbrush that has soft bristles, and you should be changing your toothbrush every 3 months, or when it starts to look sort of frayed and worn out, whichever comes first. Tip number 2, floss twice a day. Flossing will remove the plaque and bacteria and bits of food from between the teeth where your toothbrush can't reach. It can also help prevent bad breath by removing any debris of food that becomes trapped between the teeth and gums. Although there is a lack of long-term studies that prove that flossing is beneficial, I still recommend it. I can tell the difference between a patient who flosses and a patient who doesn't, just by looking at the health of their gums. Those who floss have healthier gums. I recommend gently pushing the floss all the way down to the gum line and just underneath it before you hug it round the side of the tooth and then go up and down. It's important to avoid kind of pinging or snapping the floss up and down between the teeth because that can cause pain and it won't remove plaque as effectively. Tip number 3, see your dentist regularly. A dentist can diagnose and treat oral health issues before they become severe. Experts recommend that people see a dentist at least every 6 months for a checkup and more regularly for teeth cleaning and gum care. During a routine dental examination, the dentist and the hygienist will clean the teeth and they'll remove plaque and any hardened bits of tartar. The dentist will check for visual signs of cavities, gum disease, mouth cancer and other oral health issues. They may sometimes also use dental x-rays to check for cavities where we can't see with the naked eye. How often you need to visit your hygienist varies depending on your health history, your age and your overall dental health. However, if you notice changes in your mouth, you should visit a dentist. Don't ignore it. Number 4, don't smoke. Smoking harms the body's immune system. This makes it more difficult for the body to heal, including areas of the mouth. Smoking is a high risk factor for gum disease and mouth cancer. It also affects the appearance of your mouth, leading to yellowing of the teeth and your tongue, and it can give your breath a really bad odour. Tip 5, consider using a mouthwash. Certain mouthwashes can benefit oral health. Mouthwashes with essential oils, for example, are effective at helping to reduce bacteria and reduce inflammation. A mouthwash cannot substitute for brushing and flossing, but it is a complement and an addition to these things. Number 6, limit sugary foods and starches. Consuming sugar can lead to cavities. Studies continue to highlight the significant role that study plays in adverse dental health. Common culprits are sweets, lollies, desserts, but many processed foods also contain added sugar. Just have a look at the labels. The World Health Organization recommend that you limit your intake of sugar to below 10% of your daily calories. Starchy foods such as crackers, bread, chips, pasta, they can cause tooth decay, they linger in the mouth and they break down into sugar, and the acid-producing bacteria feed on this. The acid then causes damage to the enamel and tooth decay. 7, drink water instead of fizzy or sugary drinks. Sugar-sweetened beverages are the number one source of added sugars in our diets. Sipping on soda, juice, or other sugary drinks that can lead to a higher risk of cavities. I recommend drinking water or unsweetened tea or herbal tea. Practicing good dental care from infancy to childhood and adulthood can keep your teeth and gums healthy. Brushing and flossing daily, not smoking, eating a healthy diet, and having regular dental checks can help people avoid cavities, gum disease, and other dental issues. It may also benefit their overall health. If you have any concerns about your dental health, or it has been more than 6 months since your last dental check, then call to book an appointment. Our number is 0737201811 or hop on over to holisticdentistry.au. I'm Dr. Rachel Hall, holistic dentist from Evolve Dental in Brisbane, Australia. This is the Dental Zone podcast. Thank you so much for listening. I hope you've got a lot out of this. I hope the tips and recipes will support you to have a healthy mouth, a beautiful smile, and a healthy life. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.